as far as I know, they were both in surgery all night, and then I think they finished up on Dad, and then Mom they just left it open for part of the day, and then they went back in and had finished it up the next day, the way I remember.
After we'd finished the first operation, it was clear that we were going to be unable to close Elizabeth's abdomen. The amount of swelling that was in there, if we'd have closed that abdomen, would have been so much pressure that the kidneys and bowel and lung would not have been able to function. So we left her abdomen open, in that we didn't close the fascia. We put sterile drapes over it, sterile towels, sealed the whole thing down, and took her up to the ICU.
She came back to the ICU on the ventilator, but there's a standard set of procedures that we do for any trauma patient, multiple trauma patient. So we instituted a lot of those things. Everything from the beginning, we start prophylactic therapy against clots and against GI distress, but her case, she had an open abdomen, so that took a lot of therapy on our part in order to try as best we could to keep the wounds from getting infected and keep her stable, get her through that acute phase.
After we resuscitate them in the ICU, the continued fluid loss actually allows for more swelling if the abdomen's open. We took her back to the operating room within a day and a half and re-looked at the operative sites. Is everything healing well? Is there any way that we can start closing that abdomen? Open abdomens obviously are at higher risk for infection, as well as what we call fistulas, where the small bowel erodes and you get a leak of the food and bowel contents. We went within the next 2 days, went in, re-washed it out. We're able to pull it down together. She had ripped the diaphragm completely off the anterior chest wall, and we had to reconstruct all of that area and then close her abdomen. But shortly afterwards, within 4 days, it was evident that she was still in trouble, and she developed an intracutaneous fissure where the small bowel had leaked and was coming out through the skin. And that was the start of what ended up being a very long process, trying to get her abdomen to heal, controlling the leak, controlling the wounds of the abdomen. I don't think there's a nurse in this hospital that hasn't helped with one of Grandma Lemp's dressing changes.
When Elizabeth came to us, she was severely deconditioned, and she had problems with breathing. She had problems with swallowing, and she had problems with nutrition. She had some significant abdominal wounds, and she had abnormal abdominal wall architecture. So she didn't have any muscles to support her back, so she had significant problems with back pain that really limited her activity tolerance, her ability to get in and out of bed, simple things that we take for granted every day. On the rehab unit, we had a comprehensive treatment plan for her. She did have a mild head injury from the incident itself. She underwent speech therapies. They did comprehensive therapies with regards to her thinking, communication, cognition, as well as her swallowing. She had a trach in place. She had trach site cares initially. She also underwent swallowing trials under real-time x-ray to see whether she could swallow and advance her diet. She had the nutritionist involved in her care because we were dealing with the fact that she wasn't able to sustain herself. Eventually we got to a point where she could swallow and she was able to take PO intake really well, but she was not able to intake enough food despite she was trying very hard, but she just couldn't take enough calories to sustain herself. So she still had to have tube feeding when she left.
Oh, I don't remember much. I couldn't talk, and they had me on a feeding tube, so I didn't eat anything for a couple months.
And a ventilator.
And a ventilator. I did not like that ventilator. I remember that.
It was with careful sigh of relief that I think it was after a year that we were finally had the abdomen healed, closed, no fistulas, and we still thank our lucky stars because this was an abdomen that was could have very easily. She should have not been a survivor in the beginning. But with Grandma Limp's fight and her direct determination, looking at me, telling me exactly what she wanted and what she didn't want, we were able to get through this whole process together.
I have just in the last 2 weeks, and this is January 19th, gotten off of all bandages and all. Let's see, the wound vac was taken off November 20th.
She's healed.
Yeah,
She
there's
has
no bandage, there's no nothing.
bandage, no nothing.
Nope.
Eating, going to the bathroom, her
Walking,
GI system's
dressing,
good, walking,
yeah.
everything.
Mm-hmm.
Yep.
So she is.
Yeah.
She is a miracle.
Yeah.
She's a miracle.
But she,
Yeah.
just like I said, she had to get through the point.
Mhm.
She has been sick since the accident of that June,
Mhm.
all this time, that I think she was scared to think I ever might be well.
Yeah.
Because every time I'm almost well and I
Yes.
think we got it whipped, and
And
we all think
yeah.
we got it whipped.
Something happens.
Something happens, and it ain't just a little tiny thing.
With Liz, it's a
major.
big thing. It's a major thing.
Yeah. Major.
Liz don't do things little. Liz
No.
does things big.
No, that's Liz.
That's
because
Liz.
Liz is the leader.
Liz is the very much a matriarch.
Yeah, she is the leader.
Mhm. And yeah, she's wonderful.
Yeah. So she's gonna make it this time.
She's had her hair done. She's going to move down to Branson with her daughter.
Yeah.
And I'm going to cry that day.
I know. Yeah.
I'm feeling pretty good. I'm getting stronger every day. My appetite is returning. And next week I'm going to move to Branson area and live with my younger daughter. So I'll be back in a home again.
And how's that going to feel?
That's going to feel real good.
Well, when I heard that Elizabeth was going to be going to Missouri, I had some paternal feelings, I suppose, in that she shouldn't be away from me. Maybe it's my separation anxiety from her. She's been a part of us for so long. But I know with her spirit and her drive that she'll do well, and wherever she's happy is where she needs to be.
I've had very kind and respectful caregivers. I don't remember anything of the emergency in the ambulance at all, on either going to the central city or going to Lincoln, but everyone was very nice. And then in the nursing home, they've been wonderful caregivers. So I would want to say thank you to everyone involved in my care.